Hi, this is Paul Slatkus. May is Mental Health Awareness Month. May 1st to the 7th is Tardive Dyskinesia Awareness Week. We're going to find out if I said that properly. Involuntary movement disorder impacts thousands of Americans. I imagine people all around the world. Actually, I've never heard of this. And we have a doctor, so I'm lucky because I have Dr. Rakesh Jain, a clinical professor, Department of Psychiatry, Texas Tech University School of Medicine, or Austin, Texas. He's going to discuss some of this and this concerning TD, they call it. So first of all, how do you say it?
Yes, you were very close, Paul. Tardive, which means late, and dyskinesia means an abnormal, excessive body movement. So tardive dyskinesia, TD for short.
How come I've never heard of it?
Yeah, isn't that a tragedy that societally we have not talked about this? There are 600,000 Americans who have it, Paul, and it's a disorder that can start in one or more body parts, and it is often associated with certain medications like antipsychotics. And the fact that you haven't heard about it is no fault of yours. It's the fault of us, the healthcare providers. We haven't talked about it enough, and that's why I'm here today. It's time to get this disorder out of the shadows. It is very impairing, Paul. It's not just like your body betrays you. One or more part of your body can jump. It can have a difficulty like I'm showing you on my face right now. It can affect my tongue, so swallowing and talking could be a problem. It could affect my fingers, so typing, writing, holding things. Driving could be a problem. It can affect my feet, which of course, just imagine, walking, driving, major challenges. But it's not just that. It is beyond that. It causes psychological difficulty, the distress one feels when your body is not doing what it really needs to do, and the social difficulties, the social isolation, the social ostracization that happens. That, to me, is the fullest picture of tardive dyskinesia.
So I don't know if this is similar. Epilepsy. I don't know. I just somehow feel that it's, I don't know. Am I wrong here, or is it in the same community, which many people have heard of?
Yes, and epilepsy is also a horrifying condition, but this is different. This is not the person is unconscious. It's much more so that the body part, which is controlled by a voluntary movement, has excess movements in it that I'm not trying to do. Like, for example, right now, I blink maybe, 3 times a minute. That's normal. But if I was to constantly be doing this or wrinkling my nose or grimacing, you would imagine I both get very tired. It hurts to do that. If I'm clenching my teeth, I could actually crack my molars. I've had my patients tell me that. So it's very different from it. But the very fact that you so honestly are stating, how come I've never heard about it, is exactly the key. We haven't shed light on it. And that's why I'm so thankful to Neurocrine Biosciences for the sponsorship so we can talk. And I want to really drive you and guide you, Paul, and all of our viewers to this great website that's incredibly educational called talkabouttd.com. And there, in that website, Paul, you will find both a visual demonstration of what TD looks like, the plight of our patients, treatment options, and what else can we do to make sure this disorder, the 600,000 people's plight, is no longer hidden in the shadows, that we know about it and we can do something to help them.
Let me ask you, I see you're in a psychiatry department, okay? So who recognizes that somebody might have this disease? How do they then take it from, you go to who do you go to? You go to your regular doctor, and the doctor sends you to who? What's the progression here of finding out whether you have it?
Yeah, so the first step often is with the patient and their family members. And that's why that talkabouttd.com website isn't just directed towards clinicians, it's directed towards patients and their family members and folks like you and I who care about, our fellow citizens. So when you see something, say something. But by the same token, my fellow doctors, they could be psychiatrists, primary care clinicians, neurologists, we have been trained, and the training keeps getting better on a daily basis, to recognize the condition, to make sure we accurately diagnose the condition. And if a treatment is necessary, to be able to offer them treatment. So, Paul, it's a complete loop. We all share responsibility collectively to identify these conditions and then, of course, give them support, give them understanding, give them sympathy, and to help them seek treatment for it.
Is there a test? So do you send somebody, or is this a blood test? How does somebody then figure out that this is what the concern is?
Paul, you're asking some very good questions. There is no need for a blood test. There is no blood test, but there is what's called a clinical examination. It's a clinical examination. And these involuntary movement disorders can happen when someone has bipolar disorder or major depression, or they have schizophrenia, especially when they're taking these certain medications like antipsychotics. So, yep, absolutely. The clinician will be well armed, but it is the patient's and their family members' responsibility. Really, it is, isn't it? If there is a challenge they're noticing with these muscles, is to alert the clinician, hey, what's happening? Can we talk about it? That's why talkabouttd.com becomes such a nice way to get the ball rolling, right?
I did a series called The Brain Series on PBS, the first one, made way back in the 80s. Okay, so is this, in essence, though, once we, is this a brain dysfunction?
Mm-hmm. It is. It actually is. Even though it's the body that is betraying the person, the body is actually listening to a certain part of the brain where voluntary movement is controlled. And in tardive dyskinesia, that part of the brain is overactive, if you will, has too many signals that tells your body to have all these excess movements. So you're completely right in your assessment that this is a brain challenge that leads to the body becoming pulled into the fray.
The brain runs it all.
It does. It's the boss. And that's why I have often said to my patients, and I'll say it to you also, the most precious organ in our body is our brain. But the most important possession we have, and I think you'll agree with me, Paul, is our mental health. And that's why our patients who have tardive dyskinesia, we collectively have a responsibility to help them achieve the best mental health. And tardive dyskinesia really steals that from them. So when tardive arrives, I see that as an impediment. I see that as an adversary that I need to, with the patient's cooperation and partnership, find a way to address and to knock it down.
Gotcha. All right, give that, if you wouldn't mind, give me the website one more time, doctor.
I will, and I really want you to check it out too, Paul. And that website is talk. Okay, great, thank you. Talkabouttd, one word.com.
Okay, we're going to be putting it in the same interview. We will go to it and we will incorporate it into our interview. Thank you very much. Appreciate the importance.
Thank you very much, and thank you for being a champion for mental health.
And you as well. Thank you. Bye-bye.
Bye now.